All right, good morning, everyone. Thank you so much for joining us this morning. We still have people coming in, but we'll just go ahead and get started. My name is Tiffany Narvaez, and I'm part of the marketing team here at United Ag. Thank you so much for joining us this morning for this very special episode of Health Chats. So just a heads up to everyone, since we've got people all over the country remoting, WebEx is experiencing very heavy traffic, so bear with us if there are any technical difficulties. So before we get started, I want to give a brief shout out to all of our sponsors who make all of our programming possible. Rosemary, thank you. We've got CVS Caremark, Elite, HCP National, Plantel, and Sain. Thank you so much. So a little bit of housekeeping. Please be sure to chat in all of your questions. We have allotted extra time at the end of this webinar for Dr. Koo to answer all of your questions. But if we don't get to all of them, we will have to cut it off at some point. But if we don't get to all of them, we will answer those via email. So without further ado, Dr. Rosemary Koo, I pass it on to you.
Great. Thank you so much, Tiffany. And just to echo what Tiffany said, there is a lot of traffic on WebEx right now. And based on what Tiffany was saying, there is a little bit of a lag in the slides. So just bear with us for today. So thank you, everyone, for joining me this morning to talk about coronavirus or COVID-19. Within the last, few weeks even, what we thought initially was just another flu has turned out to be a pandemic that's forced us to shelter in place.
Rosemary?
Oh, yes.
Sorry, let me chime in. You sound a little loud. You can just back up a little bit.
Is this better?
So much better. Okay, go ahead.
Okay. Thank you. So what we thought of was just a flu in the beginning has actually turned out to be a pandemic that's caused us to shelter in place and close schools and other non-essential businesses at the time to try to contain the outbreak. The CDC is a wonderful resource during this time to check regularly for updates, but my goal today is to not just parrot back what the CDC has said, because I know you're all capable of reading their website. Instead, what I'd like to do today is have a candid conversation about the latest facts on COVID-19 and also give you my advice on how to prevent further transmission. We all have a part to play in this. We all can take responsibility to make sure that we minimize the impact of this virus on our families and communities. And I do want to, also include a disclaimer that because of all the uncertainty and the rapidly evolving knowledge around COVID-19, that what I say today could actually be no longer correct or relevant even within the span of a few hours. So just take that with a grain of salt. But these are the topics that I'm going to be covering today. And as Tiffany mentioned, we'll try to leave plenty of time at the end for Q&A. So to begin with, I'm going to just start off with some terminology. So we're calling this all coronavirus, which is not inaccurate, and we could certainly continue calling it coronavirus. I will call it coronavirus, but just so you know, coronavirus is actually a whole class of viruses. It's not very specific. The specific name of the virus that we're dealing with, the outbreak, is the SARS-CoV-2 virus, and then the coronavirus infection that it causes is COVID-19. But you can use any of these terms to describe what's happening. And as you all know, this is a respiratory virus with the key symptoms being fever, cough, and shortness of breath. What's less commonly known, especially in the US, but is actually more generalized knowledge in Asia, is that for some people who get the infection, the symptoms actually come in two waves. A lot of people will experience mild cold symptoms first, actually get better, and then after a few days later develop the worsening shortness of breath, cough, body aches, and fever. So this is a little bit of a different pattern than flu. Usually flu will hit you like a ton of bricks from day one. Like you'll actually start off with a high fever and body aches. For some people with the COVID-19 infection, it's actually more of a phased approach. And some of those symptoms worsen closer to day 8 in the infection. The illness ranges from mild to severe. From the beginning, we've always said that, young, healthy people tend to have more mild symptoms. That continues to be correct from the data. We believe that the most common mode of transmission is person to person through droplets that are produced by coughing or sneezing. And while this is still thought of as the dominant way that the virus spreads, there was just data released this week that shows that the virus does survive in aerosols, so it survives in the air for up to 3 hours. It can actually be on surfaces as well. It seems to only last on copper for about a few hours. It's about 24 hours on cardboard and up to a few days on plastic and stainless steel. So we don't think that it's very common for the virus to spread by someone touching something and then you may be touching that same item. But the data is evolving. So just be careful about that. That means it's super important to continue to sanitize areas that are high traffic. And the incubation period, which means the time from infection to the time until symptoms show up, is usually around 5 days with a range up to 14 days. We think that this virus is most contagious when symptomatic, but it is possibly contagious before symptoms show up. And also, just a few days ago, there was a study that was released that 1 out of 10 people who get the virus are actually infected by someone who wasn't showing symptoms yet. So this is actually part of the reason why the outbreak is so difficult to contain, is because there are seemingly healthy people walking around who might be carriers of the virus and shedding the virus that are infecting other people. So this is why our government has taken such drastic measures such as the shelter in place and stay at home orders. Here is, it looks like R0. So this is actually R naught and it's 2.2. So R naught is a metric of basically how well the virus spreads. It's essentially a number of how many people can one person who's infected infect. So an R naught of 2.2 means that one person who's infected typically spreads the virus to 2.2 people. So if we simplify that and say it's an R naught of 2, what that means is one person can infect 2 people, and those 2 people can go on to infect 2 other people. And you can see how quickly something with an R naught of 2 can snowball. And just for comparison, the R naught of influenza is 1.3. And based on what I just told you of how this is kind of a cumulative effect, even small increases in R naught have dramatic impacts on how much the population gets infected. And so when Newsom said yesterday that if unchecked, 56% of the California population could become infected in the next 8 weeks, that's actually not an exaggeration. It's because of this high level of transmissibility that can actually produce numbers like that because the virus spreads so efficiently within the population. And in fact, from the very beginning, virology experts actually estimated that 40 to 70% of the susceptible population might get infected from this. And then lastly on this slide, I'm going to be talking a little bit about the case fatality rate. This is probably one of the most controversial numbers associated with COVID. The range is what I've seen in the literature is from, kind of conservatively 1% case fatality rate to 3.5% and above. So there's a lot of controversy. As new data is collected, we'll know more about how deadly this virus is. But what we do know for sure is that it definitely seems to be more deadly in people who are older. And in fact, in those who are 85 years and older, the case fatality is up to 27%. There's a range of 10 to 27% for those that are in the 85 and older group. For those who are 55 to 64, it's actually only 1 to 3%. So the risk of fatality from this virus increases dramatically with age. The case fatality percentage for those in the 20 to 54 year old group is actually less than 1%. And based on what the CDC is reporting, as of the 18th, there were no fatalities in people that were younger than 19 years old, which is very good news. So just because the death rate is higher in older folks doesn't mean that younger people are not experiencing severe cases of this disease, though. And in fact, 40% of the people who are hospitalized with COVID-19 are actually 20 to 54-year-olds. Less than 1% of those hospitalized are actually under 19 years old. So luckily for our younger folks, children and teenagers, they are more likely to have a very mild case of this that, and don't require hospitalization. So there's still no vaccine yet. The vaccine trials are just starting, but even if one gets approved, it will probably be about 12 months before it can actually be circulating in our population. And there's some confusion on whether or not there's an FDA-approved medication to treat COVID. Because our president yesterday said that there is an FDA-approved treatment for COVID, as he referred to hydroxychloroquine as an FDA-approved treatment. That unfortunately is not the case, and the FDA clarified very quickly afterwards that there is currently no approved medication to treat, cure, or prevent COVID. Several medications are certainly being in trials for this, such as hydroxychloroquine and other antivirals, but it'll probably be some time before those, before we develop enough data on their effectiveness and before they're kind of widely used for this condition. There is actually a wrinkle of good news in this so far. Given our work in ag, it's very important to be reassured that there are no cases of COVID spread through food or food packaging. And as of right now, the FDA does not recommend any specific cleaning protocols for facilities or food that's beyond the standard hygiene protocols that you all already have in place. However, it's very important for you to be incredibly vigilant about making sure that any employee who has any symptoms stays home when they're sick. And if that employee has a high risk exposure, meaning if anyone is in their household who has confirmed COVID, they should stay home as well, because the last thing that we need in the press is to have question about whether or not a case was infected through food or food packaging. So please, for our whole industry, be very vigilant about making sure any sick employees stay home. So let's talk about prevention strategies. Almost everyone is talking about social distancing, hand hygiene, and self-isolation. You don't need me to tell you about all those again. You can read a lot about that. What I do want to emphasize here is self-quarantine. Even if you don't have symptoms, but anyone who tested positive or anyone yourself have traveled to a hot spot, either internationally or domestically, you need to stay home for 14 days. I cannot stress this enough. This is really important to make sure that the virus doesn't spread more in our community. And then also, because there is no treatment for this virus, and as with all viral illnesses, you just usually have to kind of let it run its course. The best thing that you can do to prevent infection or a poor outcome from COVID is to really optimize your immune system. So right now, more importantly than ever, is a time where you need to get good quality fruits and vegetables for vitamins and minerals. Vitamins and minerals are generally best absorbed through food. So eat, unprocessed whole foods, get your good quality protein. and also minimize your processed foods because they don't have enough nutrition in them. And also the second thing on optimizing your immune system that I do want to emphasize is stress management. Now, if you've ever attended any of my webinars, you know I mention stress management in almost every single one of them. But stress management and immunity are incredibly intertwined. In fact, ever since the 1980s, scientists have known that under stress, system goes way down. And the reason they actually found this out was they were actually taking blood samples from medical students in the few days leading up to their tests. And in those few days, they found that their immune cells dropped significantly leading up to those tests. And these immune cells are the ones that are fighting the virus and making sure that they don't cause a severe infection. And studies like that medical student study have been repeated and validated over the last several decades. So when I talk about stress management and immunity, this is not, a nice to have or trying to make people feel better. It's actually scientifically backed that you have to do what you can to minimize stress in this situation. And it is stressful no matter what. I mean, we are facing a new norm in our society. It feels like we're walking on quicksand. Every few hours, it seems like there's a new development. But I have 3 basic recommendations for how you can try to minimize stress in this situation. And the first is that even though we are potentially physically isolated from our social network, luckily we have lots of ways of communicating with people telephonically and digitally. And it's really important to connect with others during this time. There's actually studies that show that if you don't vent, if you kind of hold back feelings of worry or anger, that you can actually increase or develop symptoms of anxiety and depression. So now more than ever, it's really important to talk about this. Most likely, a lot of other people are feeling the same way. And part of that service is, look, if you don't have anyone in your immediate family and surroundings that you can talk to about this, you can also reach out to me, and I'm happy to do a phone call. This has been something that I've offered to our United Ag employees, and I'm happy to offer that to anyone in the United Ag membership or any of our affiliate organizations. And so I just want to, say that social isolation actually makes stress worse, and it can actually induce anxiety and depression during times like this. The second recommendation is to still find ways to have joy in your life. This is our new norm, and as Newsom said, there's no end in sight right now. We don't know when the stay-at-home order is going to end. So for the foreseeable future, this is our new norm, and we have to accept that. There's nothing we can do individually to change that order. And so we have to find ways to, make it okay. How can we cope? How can we still do the things that we enjoy in life? Life doesn't stop because of this. Life changes dramatically, but it doesn't stop. So still try to find ways to have joy in your life. And then lastly, one of the most stressful things that you can do during this time is to not sleep. If you're sleep deprived or not getting good quality sleep, your stress hormones go up a lot. And as I mentioned just a few moments ago, if your stress goes up, your immune system goes down. And the impact of stress on the immune system can happen within days. So it's super important to still prioritize sleep in this time. Make sure you're getting enough time for sleep, and then do what you can to get good quality sleep. The high-risk populations are ones that have to take specific precautions. The people in that group are older adults. Sometimes 65 is used as a cutoff for that definition. Other organizations use 60. So we can be on the more conservative side and say anyone 60 or older should be thought of. Yes.
So sorry, I'm getting some messages that you're sounding a little loud. If you can back up from the microphone a little bit.
Okay. Sorry about that.
Thank you.
Thank you. So high-risk populations here include adults, those with chronic medical conditions, and also pregnant women should take specific precautions. For this group, actually, most of us, since we're in California, are not supposed to be going into public spaces for non-essential activities anyway, so continue to avoid public spaces if possible. If you can, get a 3-month supply of your medications so you don't have to go to the pharmacy. If you can get your medications delivered, even better. If you can get groceries or household supplies delivered, please do that. Try to minimize as much time as you can going to stores. If you're going out for a walk, that's usually okay. That's also okay under the stay-at-home or shelter-in-place orders. And if you are working, if you have the opportunity to work from home, you should absolutely take that. And then if you do get sick, the most important thing is to stay home. Do not leave your home, even if it seems like it's for a small errand, like going to the grocery store. Because even if you have mild symptoms, you might come across someone who's older or who has underlying health conditions that could have a very bad outcome if they get sick. So it's not just about you protecting yourself, but it's also about you protecting the rest of your community by staying home. If there are others in your household, you have to try to isolate yourself from those other people, which means either having like a designated room and a designated bathroom that only you use if possible. Try to not share food or be in kind of shared spaces with those other people. If you're sick and you need to kind of share space with others, please wear a face mask if you can. If it doesn't like worsen shortness of breath or worsen any of your symptoms, then wear the face mask. If it does worsen your symptoms, then you don't really have a choice. You can't really do that in that case. If you are taking care of someone who is sick, so say you were healthy, but someone in your household comes down with any kind of flu-like or respiratory symptoms. You should also wear a face mask when you're exposed to that person. But if you are not sick yourself, if you're not taking care of someone who is sick, you do not need a face mask. And it's best to kind of conserve those face masks for people in those other two situations who might be sick or might be in a situation where they're taking care of someone who is sick. If you do get sick, control your symptoms with over-the-counter medications. Because this is a viral infection, no antibiotics are going to help you. I know there's some questions about that, like, can you take antibiotics in this situation? Because it's a viral infection, antibiotics have no benefit. There's been a lot of controversy over Tylenol and ibuprofen. The WHO has seemed to kind of flip-flop on this, especially around ibuprofen potentially worsening symptoms. It's unclear if ibuprofen does worsen symptoms, but generally, if you're trying to control fever and body aches, Tylenol is usually the best medication to actually start off with. Because the reason why I say that is because a lot of people aren't eating very much when they're having those symptoms, and ibuprofen is actually pretty hard on the stomach. If it's taken on an empty stomach, and it shouldn't be taken on an empty stomach, whereas Tylenol can be taken on an empty stomach. So go ahead and start with Tylenol first for symptom relief. And then if your symptoms do worsen, like if you're getting short of breath, you can't seem to control the fever, you're really not feeling well and you need to go to a doctor, please call them beforehand so they can take the proper infectious disease precautions to protect their staff. And then, so we have some resources available to you. We want to be as supportive as possible during this time. Teladoc is a wonderful resource where they can actually triage your symptoms. And if they deem that you need to be tested, they can actually refer you and kind of guide you through that process. They will also work with the local public health departments to coordinate the testing. And then, of course, we have our wonderful health and wellness centers. They now recently just received all the testing supplies. And so you can also go there, but please call in advance if you think you might have the COVID coronavirus infection. And the highest risk people for the virus are people who have been exposed to others who have tested positive for the virus, or those who have recently been to a domestic or international hotspot. So please call ahead if you have any respiratory symptoms, so they can troubleshoot that. Of note, so the testing supplies nationwide are still fairly limited. And so that means that the CDC and in general healthcare providers have been guided to use pretty strict criteria for testing. So usually the testing is limited to people who are hospitalized with severe illness, to people who are elderly, even if they have mild symptoms, and to those who have known contact with someone who has tested positive for COVID-19. At this point, the CDC is not widely recommending testing of people without symptoms. This might change, though, as more testing supplies become available, but because of the shortage at this time, healthcare providers are suggested to use this pretty strict criteria. And in most counties, the testing is coordinated with the local public health department. So your provider is updating the public health department on whether a test will be pending, and both the provider and the public health department will be following up on the test result. If you do get tested and you're waiting for a result, during that time, you have to act as if you do have it, just in case, to minimize the spread. So that means staying indoors, being incredibly vigilant about self-isolating, and protecting those around you. Okay, so I know that was a lot of information thrown at you guys, and we can start opening it up for questions.
Thanks, Rosemary. Yeah, everyone, please feel free to chat in your questions. While you're doing that, I just want to let everyone know that we have an encore presentation of this with one of our Health and Wellness Center providers, Ilse Tejeda, and she will do this entire presentation in Spanish. That will take place this upcoming Friday at 11 a.m., so please be sure to register for that. We also put together this great webpage on our website, unitedag.org/coronavirus, where we've compiled information from everywhere, federal, state, CDC, everything relating to coronavirus, and we keep updating that. So please be sure to check that out. We have one question here. Are drive-through testings for COVID-19 available in California?
So what I've heard is that they're opening, and in some areas they are available, but they have to, most of them require a doctor's order to even go there. So it's not like you can just drive up and get tested. You usually have to call your health system in advance to get a provider's order, and then you can go.
Great. Oh, they're all coming in. Okay. Let's see. So, is COVID cured in China?
I have not heard of any cure in China for COVID.
Okay. My elderly mom has a cold. She hasn't been to any hotspots or exposed to anyone that has tested positive. How concerned should I be? That's a good one.
Yeah, that's a very good one, and it's probably going to be a common situation for a lot of us. So what I recommend is for you or her to call your healthcare provider to see if they recommend testing in the situation. We do know that there is community spread of the virus, and community spread means that people can get sick without having traveled anywhere, or without knowingly being exposed to someone who has tested positive. And so given her advanced age, they might still test her. I'm not sure. That's going to kind of be on the call of the physician who is overseeing her care.
Great. Here's another one. In consideration of privacy regulations, how do employers address the discovery of an infected employee who may have been in contact with other employees?
Yeah, that's a challenging one because if you so so the ways in which you would find out if an employee has it is if the employee tells you or if the public health department tells you, and then you have to do whatever you can to maintain the confidentiality, but you still have to gather the appropriate information for risk assessment, which means figuring out which other employees might have been within 6 feet of that person for a prolonged period of time. So if you do that assessment and you're looking at, who might have a desk or who might work closely with that person, it becomes pretty clear pretty fast who that person might be. You still have to do that information gathering, and you just have to, try your best to maintain that confidentiality.
If you have a runny nose, itchy ears, headache, is that a pre-sign of the virus?
So those would be considered quite mild symptoms, and as long as there's no associated fever, cough, or shortness of breath, that would not necessarily be typical of the virus, and that's per our understanding today. However, we know that, especially younger and healthy people might have very mild symptoms. Occasionally, people might have no symptoms. So even if you have mild respiratory symptoms, the safest thing you can do for your community is to act as if you had it. And I know that sounds drastic, but that just all that means is to self-isolate as much as you can, not go out to the grocery store. If you do have mild symptoms like that and you don't have any known exposure to someone with COVID, or travel history, most likely you won't be tested in our current situation. So, but the most prudent thing to do is to act as if you possibly had it to prevent spread in case you do.
Great advice. And here's another good one that I'm wondering as well. What are the hotspots?
Yeah, this changes almost hour by hour. And almost and I mean there are okay, New York is probably one of the biggest hotspots in our country. Obviously, any of the foreign countries that were on level 3 or above travel bans were hotspots. Anywhere in Europe right now is considered a hotspot. So the best thing to figure out if there's a lot of community spread is to kind of look at the news of the area that you were in or are currently in. California does have a lot of cases, and there are certain counties that have more cases than others. And usually that information is posted on your local county's public health department website. But yeah, in California, much of us would probably be considered being in a hotspot.
Should farm labor operations limit their crew sizes, or does social distancing, good hygiene suffice?
That's a tough one. I am by no means an expert on operations for this, but the general recommendation, if you can comply with the general recommendations around hygiene and 6 feet of distance with your current crew sizes, you should be able to maintain that. If you cannot maintain social distancing with your crew size, then you will have to cut down. And what I'm in that's not necessarily an HR advice. That's more of you need to do what you can to maintain that 6 feet of distance.
Here's a good one, but I'm going to butcher it. My parents are in Mexico. Mom has AFib and dad has diabetes and HTN. Should they come back to the US, or would they be safer over there?
So all of those conditions would be considered underlying chronic health conditions. So they are at increased risk, and they're probably in the age group that is at increased risk anyway, even without those conditions. Whether or not they're safer there, or here, I honestly am not sure because, like I said, the hot spots where there are more community spread is very localized. I don't know how to compare whether or not there's more community spread in their specific location in Mexico versus their location here. I also am not super sure what the border looks like right now with travel. And so they would want to look at that because I don't even know if it's how feasible it is for them to get over here. So those are the things that you would want to consider is the feasibility of that travel and whether there's more community spread in their local geography in Mexico versus the local spread of where they would be coming to in the US.
Can you speak about home test kits which are being advertised? When is it appropriate and what are the steps to effectively utilize home testing?
That's a great question. We we don't know a whole lot about these home test kits, and depending on the company, they might have different processes. But my understanding is that the home test kit allows you to basically just take the sample yourself at home, but then you mail it into the lab. So it's still the lab does the analysis. It's not like the test kit at home gives you a reading at home. You still have to send it to the lab. And so the test kit is basically as reliable as whether or not you can take the test or take the sample appropriately at home. And what we know from test kits with flu, people are generally pretty good at collecting the samples at home. They can do it, and we've known that from flu. So most likely, if these test kits are explained correctly and they guide you through the process of collecting at home, you should be able to get a fairly reliable result once it's sent to the lab. Uh, how this is, kind of utilized in process we're gonna have to see it because these consumer test kits, they are not saying that they need a physician's order. So in the back end, they might have physicians authorizing, and some of them will have surveys up front. So it's not like you can get a test kit. Um, uh, it's not like everyone who wants a test kit can get one. They might kind of limit or ration to those who are at highest risk, like those who are in the age group or have underlying health conditions, or those who have more severe symptoms might be the ones who get prioritized through the survey. I'm not exactly sure what the back end of these platforms look like, but that would be my guess as to what their survey is used for. And then a lot of them are saying that they will coordinate any positive test results with the local health department. So they will notify kind of the local health department if they do find a positive test result. So this is a process that's kind of running in parallel to the health system. Because you don't necessarily have to go to your doctor to do this, you can potentially just order your own test kit at home. So we might see an uptick of people doing this. It's certainly legal, it's plausible, and it might be a nice way to kind of reduce the burden on our healthcare system.
Okay, and we have a popular question here. Do our United Ag Health and Wellness Centers have available testing kits?
Yes, they received supplies, and on the off chance they run out, they've had a process in place for a while now of how to refer you to get tested. So you're covered on all bases with our health and wellness centers. But call them in advance if you have symptoms, though. I cannot emphasize that enough.
If my boyfriend traveled back from the Netherlands 8 days ago, should he get tested? He didn't have contact with anyone that had it.
If he is not showing symptoms, uh, he probably won't get tested. We're trying to prioritize people who do have symptoms within 14 days. If he develops symptoms in the next 6 days, he should get tested, though. And then, given what we know about potential spread without showing symptoms, if you are in close contact with that person, it's probably a good idea to try to stay at home as much as possible, just in case you have gotten infected.
Okay, and here's a good one. What is the protocol if you have been in contact with someone who has had secondary contact to a person who has tested positive?
Yeah, that's considered a contact of contact. And so there's no routine testing of contacts. So if you're kind of like one order removed, you're basically kind of assumed to have the risk of the general population.
Okay. Will any UABT services be impacted by the California shelter in place order? And I do want to remind everyone that things are changing very rapidly. So if we cannot answer your questions right now, we will send an email. But Rosemary?
Tiffany, can you repeat the question?
Well, yes. Will any UABT services be impacted by the California shelter in place order?
We are working our hardest to make sure minimal impact on our own business operations. The only slight change is our business hours, and we will keep you updated on all of that. But for us, luckily we are a tech-based company. We are very capable of working remotely for a lot of our departments, and so it should have minimal impact to our membership. And we're striving to still be as supportive as possible during this time.
Okay. Another good one. How does the 6 feet social distancing affect bus rides to and from work for ag employees? It's a good one that you might not be able to answer, but again, we will try
Yeah.
our hardest.
Yeah, so the recommendation is even on public transportation to stay 6 feet away from each other. Honestly, in practice, I don't know how this is possible. And it's almost like you have to hope that your bus is not that crowded because from at least from what I've seen in Northern California, there's no way to actually enforce this at the moment. It's not like the bus driver is measuring distance. I have not seen them not allow people on the bus. So it's a recommendation, one that's not really enforced yet, but you have to do what you can. So if you see a bus that looks fairly crowded and it looks like you can't maintain 6 feet from other people, you might want to wait for the second bus. And I know logistically that can be tough. That might mean that you're a little bit late to work. But I think during these times, like us as employers and managers, just we need to be supportive for the people who work for us. And we need to assume that everyone has, kind of the health and safety of themselves and their communities in mind and be sensitive to situations like this. So, in case someone has to wait for the next bus, it's better to wait to try to maintain that 6 feet of distance than to risk ourselves by getting on a crowded bus.
These are great questions. Keep them coming. While you chat in more questions, I do want to let you guys know that we will send an email update after this because, again, things are changing so rapidly. And as we're getting this information, we will disseminate it. But keep a lookout. That will come. Um, Here's a question I'm not completely sure I understand, but what's the protocol for being in an office with over 10 employees where there is still outside foot traffic?
I'm not sure I understand that question either. Does that mean there are folks coming into the office?
Yeah, Stacy, if you can clarify. It'll give you all a chance to ask more health-related questions if you have any of those. Yes, clients still coming into the office. So, what's the protocol for being in an office with over 10 employees where clients are still coming in and out of the office?
Um, they should still all try to maintain 6 feet of distance. Um, if you are having meetings with the clients, it's probably a good idea to keep a very good log of who those people are and when they were in the office, if you don't already. Most of us have kind of protocols that will, time people in and time people out. Just in case one of the employees does come down with the infection, you would want to notify anyone who might have been in close contact, including any outside clients. But yeah, we, in some organizations, we've started closing our doors to outside clients coming in. That's not a bad idea. That might be something that you'd want to consider to minimize spread. But if you can't avoid that, just try as much as possible to maintain the 6 feet of distance between those clients and any employees.
While the questions are still coming in, I do want to reiterate, there will be no change in service coming from United Ag. Even though things are changing very quickly, we are working to keep everything the same. And we will send out a list of FAQs next week. We will service our members and our service reps at the same level. So just want to reassure you all. We have another question. Does the coronavirus travel through open wounds?
I have not heard of this being as a common mode of transmission. It's mostly through droplets that end up kind of, if you touch a droplet or exposed to a droplet, and then it kind of gets into your respiratory system if you touch your face. I have not heard of it being spread through open wounds.
Okay. All right, I'm gonna allow more questions to come in. Any more health related questions? We have about 10 minutes left. And Rosemary, feel free to add anything as you think of it.
I just want to say, I know like keeping up with the news can actually be quite stressful during this time because there's a lot of stuff that's said and then it turns out to be false. For instance, uh, there were kind of rumors of this virus being man-made, and now we know it's most likely not man-made. And so try to filter. I would focus on the news that impact your quality of life at this point. Everything else is kind of secondary. Kind of, focus on what might impact your business operations and your own lifestyle. The rest of the things like, what is the origin of the virus? Are there conspiracies with this? I would try to avoid news like that because there's just so much unknown at this point. But as far as the genetic studies on the virus, it does look like it was, kind of from nature. The genetic studies look like it's most similar to coronaviruses that are in bats and pangolins, which are kind of an armadillo-like animal in Asia. And so it does have a wildlife basis, it looks like.
Okay, here is a good question that I actually have as well because my sister is pregnant, but my sister-in-law is pregnant. Is it safe for her to continue going to her doctor's office? And is she part of the compromised persons?
So she could potentially be at a higher risk. In fact, most respiratory illnesses, if pregnant women get those illnesses, like if a pregnant woman gets flu, they have the potential of having a more severe outcome than someone who is not pregnant. So she needs to take extra precautions. Regarding whether or not she should go to the doctor, she needs to talk to her doctor about that. I'm not going to recommend her skipping her regular checkups. Like I cannot say that over this webinar. But she has to talk to her doctor about what they recommend her doing. during this time. Certainly, if she is sick, she needs to get medical advice immediately. If she is healthy and these are normal checkups, she should check with her doctor on what the risk would be in coming into the office for those.
And if I can add to that, as I mentioned, my sister's pregnant and they're not allowing any guests into the hospital. So it was just her, my brother-in-law couldn't go in. So they're taking extra precautions to only see the patients and not having extra people in the office. Okay. We've been asked by our local hospital to send over morbidity reports when sending over the PUI form. Do you know if this is required? This one seems a little more technical, so Rosemary can follow up via email.
Yeah, I'm not sure about what those regulations are, and but employers are not supposed to be the reporting entity, by the way. It's usually the healthcare providers who get the test results to report because in most situations, the employer is probably the last to know if someone is sick or is confirmed to have the virus. I did see a question about pets. Um, so right now, there's no confirmed cases of the virus being spread between human to a pet or from a pet to a human. But the CDC does recommend that if you're sick, to try to maintain distance from your pet and to maybe have someone else take care of them during that time.
How would you recommend going out to get supplies? Wear gloves, sanitize, etc.?
Uh, Very good question. I would first say try to get your supplies delivered as if possible, because while that, you still have people touching it with delivery, right? You have the person who delivers it and the person who packs it, but you might have fewer people from the community touching your item as well. So first thing is I would recommend getting delivered if possible. If you do have to go out and get it, make sure you pick a time that is very low traffic. If you have senior hours or kind of a limited hours in your community where stores are saying only people at high risk can go, if you fall in those categories, definitely use that. And if you still have to go and you have to go at a high peak time, I would, you don't need to necessarily wear gloves. I've not seen that as a CDC recommendation to wear gloves or masks if you are healthy going out into public. But I would just say be very careful about hand hygiene. Everyone says to not touch your face. We say that, but I know that in practice that's very difficult because not touching your face is subconscious. So you can't regulate an activity that's subconscious. And then try to sanitize when you can once you get home.
Sort of touched on this, but I actually have a question, if I may. Um, Face masks. I hear that they're good. I hear that they don't work.
Yeah.
What's your recommendation?
The recommendation is that if you are sick, you have to wear a face mask if you're going to be exposed to other people. If you are healthy, but you are taking care of someone who is sick, you also need to wear a face mask when you're taking care of the sick person. If you are healthy, and in kind of general, just going out into the public, you don't necessarily need to wear a face mask.
Thank you for clarifying. Okay. Hold on. We have another one. Does opening windows for air circulation in the office and in buses help reduce risk of contamination?
I don't think there's any data to say that that's wrong or to say that that's correct. So I don't know.
Okay. And answer to Robbie, will this health chat webinar be posted on social media to share with friends and family? Yes, we will post this on our website. And this is a great webinar and a great resource. So yes, we will share this everywhere. Okay. My grandson is coming home from college. Someone in the house is under chemo. Should we have him stay in another location for at least 7 days before he enters our home?
Uh, That's a really good question. These calls are really difficult to make. If there is known spread at the college that your son is coming home from, uh, yeah, he probably should quarantine for the time being, for probably 14 days. That's if you know of cases on that college campus. If there are if there are no cases on the college campus and your son is perfectly healthy, has no symptoms at all, probably okay. Um, but these are super hard decisions to make, unfortunately, because we don't we don't have enough testing to be able to test everyone who doesn't have symptoms, and so I can't say 100% that I can't say 100% that there's no risk that he might have picked something up while he was there.
Okay, we've got a couple more really good questions coming in, so let's try to get through these. Let's see. If our food supply is more limited, what are some recommended vitamins and minerals to supplement?
Yeah, that's a great question. I think in preparation for that, if our food supply is impacted, I'm assuming there is probably going to be a disproportional impact on fresh produce. So in the time being, I would try to stock up if you can, and I don't mean hoard, I mean stock up a little bit, on frozen fruits and vegetables if you can, to just have them on hand, because the nutrition in frozen fruits and vegetables is quite good. If there's a situation where there's no way to get fresh or frozen, the vitamins in most daily vitamins, they have, A, C, vitamin A and C. They all have some zinc in there usually, and minerals. There's not necessarily one daily vitamin that I recommend more than others, because they all have similar things in them, and they usually all cover the basics.
That was a really good question. Okay, two more questions and we'll wrap this up. Is soap and water better than alcohol rubs with COVID-19?
Um, from what the CDC is saying, and what I've kind of seen in their videos and websites, it seems like they're recommending hand washing or the hand sanitizers that are alcohol based. So I'm not sure if one is particularly much better than the other. So I would do whatever's convenient, and something that you can comply with.
Okay, last question. Will any type of mask work, or is there a specific type to use for COVID-19?
So this is a hard question. So healthcare providers use the N95 ones. We are actually typically fitted for them, though. It's not possible for the general public to be fitted for them. But they are kind of the most reliable type of mask, but that's assuming that they're fitted correctly. Um, I think we have a huge shortage of masks in our population right now. So honestly, I would go for getting masks that you can get if someone is sick, or if you're taking care of someone is sick. And if you can get N95, wonderful. They're probably super limited right now. Just get what you can, though.
Okay, one more question because it's another good one. Um, if you are showing mild cold symptoms and are young and healthy, but live with someone at higher risk for COVID-19, should you be tested?
If you yourself have not been exposed to someone who has the virus, and if you have not traveled from a place that has a lot of cases, you probably won't get tested. That's a different question than whether or not you should be tested. but the practicality is most likely you wouldn't get tested. What you should do though is act as if you did have it, and take every precaution possible to minimize potential spread to that high risk person in the household, which means isolating yourself in the house, cleaning off any surfaces that are kind of high traffic that you might share with that person. If you can use a separate bathroom for that person, do that. And otherwise, do what you can to contain yourself while you're symptomatic. Because yes, like young people can have very mild symptoms, but still have the virus.
Great. So we're out of time, but if you have any more questions, please email them to membership@unitedag.org and we'll make sure to answer those. Dr. Koo, thank you so much. This was very, very informative. Do you have anything else that you want to reiterate as a doctor for all of us to know? There's one thing you have to reiterate. What would it be?
I think the one thing is very basic in that we have to remain supportive of one another and compassionate and understanding that this is an incredibly stressful situation that none of us have experienced before.
Yes, let's all be kind to each other. All right, well, thank you so much. Thanks to everyone for joining. We will post this online as soon as we can, and we'll answer all of your questions. Keep checking your emails and unitedag.org/coronavirus. Don't forget to tune in next Friday for the Spanish version of this with Ilse Tejeda. Thank you so much and have a great weekend.